Hello, everyone. I am Shani Weber with the Ehlers-Danlos Society, and I'm going to talk with you about how to have effective doctor appointments. The topics I'm going to go through today will be building your medical team, preparing for those doctor appointments, tips for while you're at the appointment, and as well as telehealth appointments, as we know we're doing a lot of those right now. I'm going to also talk about the emergency room or the A&E for those in the UK, and what to do if you're hospitalized. And then I'll finish up with patient best practices. So let's start with what is a medical team? It's important to know that there's not one specific doctor or a medical specialty that can investigate and treat every symptom that our conditions can cause, as well as any comorbid condition that any of us has. And so we've got to build medical teams that have the specialists that are appropriate to the symptoms and comorbid conditions we have. Um, and so our medical teams may look different from one another. Um, who you have on your medical team may be different from another person you know who has a type of EDS or HSD. But it should be appropriate, the different specialties, for what symptoms and conditions you have. You are the medical team captain. I know that we all want to find that doctor who is going to organize all the other doctors on our medical teams and communicate with all of them. Unfortunately, our medical systems are not created to do that at this time. And so we have to be our own medical team captains. You're the most important member of the medical team, in fact, because you're the one that's going to be impacted by what care you get or what care you don't get. So it's going to be up to you to share information with each of the doctors on your medical team about what's going on with you, but also what are your other doctors doing? What are they prescribing? What are they saying? What procedures are you having with other doctors, and so forth, so that all the doctors on your medical team can be kept up to date. So what makes a good doctor? A good doctor is somebody who is maybe not an EDS or HSD expert, but who's willing to learn. There's somebody who is a good communicator you can talk with, somebody that you feel that you have an equal relationship, the patient-doctor relationship that is equal. You want a good doctor who listens and is a good problem solver. But while we're talking about what makes a good doctor, we also have to think about what are things we need to be doing ourselves. So a good patient is somebody who takes charge of their health. They know that it's up to them to feel and function the best that they can. They're an active participant in their medical care, and they understand that when they're seeking medical care, it's not the time for a lot of emotions. It's a great time for problem solving. It's a great time for data sharing, but it's not a great time for a lot of emotional type behaviors or seeking validation and those sorts of things. And so those need to be left at the door. You can use your friends and family and support groups for our emotional needs. A good patient is prepared and comes on time and is willing to try different treatment options. And last of all, a good patient is honest. There's just not a way to get good medical care if you are not honest with your doctors and if they're not honest with you. So how do you find doctors for your medical team? Well, you can get recommendations from family and friends, but also know that organizations like ours, like the Ehlers-Danlos Society, are great resources for learning who is best to see on your medical team. On our website, we do have a medical professionals directory that you can check out. But you can also connect with your local EDS and HSD support groups. Not only does that allow you to connect with others who are living with these conditions who live near you, but they are also the best resources for learning who is best to see and maybe who's best not to see. Then you get to decide who will be on your medical team. Is this doctor willing to learn about your conditions? Are they open to questions? Do you feel that you and this doctor can work together? Do you want this doctor on your medical team? So, how do you get the help that you need? Well, you have to have reasonable expectations. You have to collect data. You have to create a goal. You have to prepare an appointment agenda and communicate with your doctors effectively. So, let's start with having reasonable expectations. I have examples here of unreasonable expectations and reasonable expectations. For instance, if you have an expectation that every doctor you see is going to be an EDS or HSD expert, that's not reasonable in this time. We're hoping to get there, but at this time, it's not a reasonable expectation. A reasonable expectation would be, I want my doctor willing to learn about EDS and HSD and to be curious as we go through this journey together. An unreasonable expectation may be that I want my doctor to run hundreds of tests and whatnot to find an answer. I don't know how many of you are familiar with that show from many years ago, House. But it was about a doctor who did exactly that, ran every known test in the world until he got an answer for what was causing a person's symptoms. But that's not really a reasonable expectation. Uh, there are limitations to modern medicine, and a good focus can be not that we get cured or fixed right now in this day and time, but that we can effectively manage the symptoms we have so that we can feel and function our best. When preparing for an appointment, you need to have an appointment goal. Your appointment goal is the purpose. Why are you going to this a doctor's appointment? Or why are you seeing them via telehealth? This goal is decided by you. What do you want it to be? Maybe you want tests to be run, or maybe you want to talk about braces or mobility aids. Maybe at this appointment, your goal is to discuss with your doctor these new symptoms you're having so that you can start the investigation to see what's causing them. Or maybe you want to be referred to another specialist. Well, we do need to collect data so you and your doctor know what to do, especially if your goal is to talk about new symptoms you're having, for instance, or if your goal is to follow up on how a medication or a treatment option is going, or if it's not going well. um, so you want to track things like, of course, the pain and symptoms that you have, but also any triggers that there may be. Are your symptoms triggered by things you eat? Maybe collect data on the weather. Sometimes weather systems or barometric changes can cause us to feel worse. Maybe good weather or warm weather or cold weather helps or hurts. And so think about those triggers or even possible triggers and collect data on those too. This can help you really determine what is triggering the symptoms and what isn't. Be sure to also record what medications and supplements that you're taking to see if those are helpful or what other treatment options you're doing. so that you can determine whether those are working for you or not. You can collect data the old school way with a pencil or pen and your own paper, or downloading a chart like this one. The important information you want is the date and time that you're writing about your pain or your symptoms, what it is that you're feeling, what were you doing right before these symptoms got worse, and did you do anything about the symptoms or pain? Did you take any medication or use a foam roller or something else? And how did that work? And then you can leave additional notes. If you are able, it's really helpful to take your data that you collected in your chart or a diary or in whatever form was comfortable for you, and put it into a graph. There are many tools on the internet that can help do this for you. But using a line graph, a bar graph, a pie chart, any of these things will help your doctor look in just a moment what is going on. You can see this sample line graph is able to show when pain, swelling, and mobility are affected, right, over a course of days. And it's also showing 2 different treatments that this person is trialing to show how they worked. As you notice in the blue line, that's going down. This person tried cold cure. I'm not sure what either of these treatments are, but that doesn't look like a treatment option that was working very well. And on the red line, a BFST, whatever treatment option that might be, looks like it works some and doesn't, and then does. Kind of waxes and wanes, doesn't it? You can also use symptom trackers on an app. If you are iOS or Android, there are many, many options. I listed just a few of the many options out there. You can find which one really is one that you're comfortable using, but I want you to also look for what features each of them have that you are considering. For instance, some of the symptom trackers are able to convert what you record into those bars and graphs that I just talked about, or into a report for your doctor. Some of the symptom trackers are also able to automatically send or manually send those reports to your doctor via email or sometimes with patient portals. That's saving you steps. And so think about what options are important to you and what options would help you and your doctor better determine what is happening and how treatment options are working. Before each appointment, create an agenda. You need an agenda for each appointment. In your appointment agenda, you're going to list your appointment goal, the medications and relevant medical history that you have, a timeline of these new symptoms, what's been happening, what you've tried for treating them and how that's worked, and show any samples or those charts that I was talking about, or pictures, if you have pictures of rashes or whatever is going on, or a short video of the symptoms even. This is a sample appointment agenda. This is what you create before going to the appointment. Notice that you include the date, what doctor you're seeing, and that you also include what vitals are they taking at your appointment. Do they take your weight, your blood pressure, and your heart rate, for instance? Are they taking any other vitals when you go to your appointment? Put spaces for those so that you can record them. You want to write next your appointment goal. For this person, they want to determine the cause and review treatment options for increasing dizziness. You want to write what diagnoses you have. This person has hypermobile Ehlers-Danlos syndrome and osteoarthritis. And you want to put what medications and supplements that you take. This person takes Tramadol and vitamin D3. And then you want to list what health issues are new since the last appointment, since this doctor last saw you. Notice that in writing what's new, this person didn't just write, I get dizzy. They wrote, how frequently are they getting dizzy? What are they doing when they get dizzy? How long has it lasted? And who on the medical team also knows about these symptoms. Then you list the treatments you tried. So this person is trying to consume 80 ounces of fluids a day, salting their food, wearing compression hose, but none of it's helping. You want to leave a section for notes, and you want to write down your questions. Limit your questions to 2 or 3. The appointments are not long, and so it's not a time for hundreds and hundreds of questions at regular appointments. So what are your most important 2 or 3 questions? At your appointment, let me go back. I think I put it out. At your appointment, you are going to fill these in. You'll fill in the weight and the blood pressure, the heart rate. You'll share all of this with your doctor. You'll write in notes of what you talk about with this doctor, what their recommendations are, and so forth. If you have additional questions, you can ask them. If there are questions that came up during your discussion, that's okay. Please make sure that you provide a copy of your appointment agenda to your doctor so that they can be looking over it at the same time you are looking over it. With telemedicine, this would mean emailing it to them beforehand or sharing it through a patient portal. If it's in person, it means handing them an agenda, a copy of the agenda, if you did not do so electronically beforehand. Not only does that help both of you during the appointment, but the doctor then will put this in your medical records so that you know there's a record of what's going on with you that you described. So share all of the information that you've collected, state your goal, and share your data at that appointment. At that appointment, we can't do this right now during a global pandemic, but it's good to bring a family member or a friend, anybody, as an extra pair of eyes and ears when possible. We can have brain fog. It can be hard to remember what the doctor was saying or what questions you wanted to ask. And so having somebody extra there can really be a help. Take notes during the appointment or ask to record the appointment. It really is too hard to remember everything. When you are talking about what symptoms or pain that you're having, be very specific. Instead of saying, for instance, I have headaches, say something like, in the last month, I have had 7 headaches, all at the base of my skull, with stabbing pain above my eyes, which disrupted my sleep and my ability to drive. So instead of just saying, I have headaches, I have listed how often these headaches are. I've talked about where I am feeling these symptoms. So this is all the nature of the symptoms. I have also talked about the functional impact. What are these pain and symptoms impacting when I'm trying to live my daily life? What am I not able to do because of these symptoms? All of that gives your doctor more information, and the more information they have, the better problem solvers they can be. At your appointment, remember that doctors are experts of the human body. It's not where you're looking for validation, but you are looking for problem solving. Be sure to be open to trying different treatment options. Um, if you say no to everything, the doctor doesn't have any way to help you. Let's go through quickly telemedicine appointments. Um, we're all becoming experts of these, I think. Now, some of these telemedicine appointments are by phone and some are virtual. They're online, maybe through one platform or another. I talked with many patients and doctors about what really is helpful during a telemedicine appointment, especially. Many doctors talked about difficulties in doing examinations, examining patients. Technically, it can be done, but it's very difficult. And so really, telemedicine appointments are best for documenting what's going on. Of course, what we've been talking about already is documentation, right? It's collecting data and it's turning them into graphs, into reports, and appointment agendas. And so all the things we talked about having effective doctor appointments, are what telemedicine appointments are great for. Let's talk about the emergency room or the A&E real quick. Their role is to stabilize patients. Stabilize patients. Why? So that the patients can be referred back to their local doctors or so the patients can be admitted into the hospital. Notice that their role is not necessarily to investigate and find the exact causes of all symptoms and pains, nor is it to treat all symptoms and pains. They are supposed to stabilize you so that you can get to your doctor or be admitted. There are definitely times to go to the ER or A&E. These are just some of the many examples. If you're having chest pain with vomiting or if you're having shortness of breath, anytime you're having troubles breathing, right? A sudden or sharp abdominal, chest, or pelvic pain, or unexplained bleeding, anytime you have difficulty speaking or a partial paralysis, a loss of vision, sharp flank pain, or broken bones, of course, go to the ER or AE. But there are times when you really don't need to. Think about your symptoms or your pain. Is this a time where your symptoms or pain can wait until you can discuss things with your doctor? If you know what the problem is, but want the ER to give you pain medication, that's probably not a time to go to the ER. If your doctor has not figured out your symptoms, so you're really hoping that Dr. House or a doctor that's going to run hundreds and hundreds of tests is going to be working in the ER that day, that's not going to be happening, I'm afraid. And so it's not a good time to go to the doctor or to the ER, I mean. And this is one I see too frequently. If you're well enough to ask on Facebook or other social media, should I go to the ER or the A&E? That's probably one that you can wait to discuss with your doctor. But if you are admitted into the hospital, make sure you do bring your list of medications, your list of doctors to contact, surgeries, any of that kind of thing. If permitted, have an advocate there with you, a family member, a friend who's there with you. I know right now that's not something that's permitted in most cases. Make sure you have a bag of things to do that you enjoy, that you can bring with you. Maybe you like to read books or knit or whatever it is that you like to pass the time. Comfortable clothing, a pillow, your insurance information, your emergency contacts, and the most important thing, your phone charger. Everyone brings their phone and forgets the phone charger. We need to make sure that we are having regular checkups as well. Do not assume that every new symptom or pain is due to EDS. We are really quick to assume a new pain or symptom. Oh, it's my EDS getting worse, or it's just an EDS thing. There are too many examples in our community who did that, who assumed that that new pain or symptom was due to EDS or HSD. And by the time they went to a doctor to investigate it, they were diagnosed with stage 4 cancer, for example. It's so important that we not assume everything is due to our EDS or HSD. Get those regular checkups. Beware of red flags. For instance, when you're talking with your doctors, communication issues, a condescending attitude. If they're unable to answer questions or unwilling to discuss concerns, or they're not even willing to explore treatment options, or they're disrespectful or not respectful of time. These are all red flags. But note, these are also red flags for patients. These are behaviors that we don't want to do ourselves, but they're also behaviors that we don't want our doctors doing to us. There are many tips for patient best practices. Do things that, like the basics, like knowing where it is that you're going for a doctor's appointment so you won't be late. And get there early enough to fill out paperwork before the appointment time. Keep all your prescriptions through one pharmacy. Understand the limits of the medical world. We are not at a point in history where all test images, prescriptions, surgeries help fix, help identify any condition or symptom. But we can expect that we can manage our symptoms the best that we can. Be sure to say thank you to all of those who are trying to help you, doctors, nurses, the staff, anytime you see good service. Make sure you're being honest about how you're taking your medications and what's going on. Also, don't take it personally if your doctor is discussing weight or smoking or lifestyle choices, other lifestyle choices. They're sharing information they know about known health risks, and so that's part of what they've been educated in. It's up to us to live the best lives we can. As well as the do's, there are quite a few don'ts. We really want to understand that these appointments may only be 15 to at the most 30 minutes long. It's not a long enough time for doctors to read your entire medical history or to read EDS and HSD medical journal articles and that sort of thing. When you're sharing articles of information with your doctors, which it is very important to do as we train our EDS knowledgeable doctors ourselves, that you bring articles from scientific peer-reviewed journals or from international or national organizations. These are things that doctors will respect. If you're sharing with them Wikipedia or someone's blog or somebody's social media post, these aren't really sources that your doctor's going to respect. Thank you. Excuse me. Thank you so much for your time. If you have any questions, you feel free to email me. I did a webinar on this topic back in May. If you want to see a more detailed explanation of some of these topics, feel free to look for my webinar on Ehlers-Danlos Society's YouTube channel. I truly hope you get the care that you need. Thank you.